ADHD is a neurodevelopmental disorder. It's something that the heritability factor is 0.77, 0.78, so that's something that 75% of the time, if you have the diagnosis, you have it because of the genes that you're carrying. There are 3 hallmark symptoms with ADHD. It's hyperactivity, impulsivity, and inattention are the core features. And then you'll see often associated features, things like difficulty with executive functioning, which means organizing, time management, task initiation, goal-directed behaviors. Some of those can coexist with the core ADHD symptoms. I think that people often will ask me, is ADHD overdiagnosed, or that's the perception that ADHD is overdiagnosed. My answer to that is I believe it's both overdiagnosed and underdiagnosed. We tend to overdiagnose the kids, adolescents that have a lot of the hyperactive features, the features that you can see. So the teachers that are frustrated that the child's struggling with behavior in the classroom, the child who parents are frustrated who maybe not be getting good grades, the things that people can see and it's tangible. I think we do overdiagnose in those patients because there's many other reasons that kids may be struggling in school, not just ADHD. I believe the folks that are at risk for underdiagnosis with the condition, meaning we're missing it, are the folks that have more of the inattentive type of ADHD, more of the inattentive symptoms, the cognitive symptoms. So they are the ones that are quietly struggling to pay attention, to listen to the teachers, to be able to read, to get through their homework. They're not showing any behavioral outward symptoms, so other people may not be aware how hard it is for them. Those are the folks I think we're very much still under-diagnosing. Because ADHD is a medical condition, the medications are a large part of the treatment recommendations and guidelines. And this is coming straight from the American Academy of Pediatrics. If you look at their protocols for children ages 6 and above, the first line treatment for ADHD is a combination of medication and cognitive behavioral therapy. This is the American Academy of Pediatrics. This is not the pharmaceutical company information. For the younger ones, however, for kids that are preschool age, so the 4-year-olds, the 5-year-olds, first-line treatment for that age group is behavioral therapy first. We understand that the younger ones, being a little bit more cautious with medications may be warranted because the research that was done on the risk of potential growth delays seemed to relate back to the little ones, so when it came to medications. But age 6 and above, first-line treatment per the American Academy of Pediatrics is medication management with cognitive behavioral therapy. I have the conversation in my practice every day with my patients who are trying to decide about treatment options with regard to explaining there are side effects to medications. Absolutely, we know what to watch for, but there are also side effects to not medicating. In other words, there are side effects to not treating ADHD. Untreated, unmedicated, these kids, adolescents, and adults are at risk for significant negative outcomes. The rates of car accidents, for example, go up unmedicated. These folks are more likely to have traffic violations, car accidents, trips to the emergency room, physical injuries. So the risk of divorce goes up 2 times that of the general population in folks that have, or one of the individuals has ADHD. The risk of potential career problems goes up, where they're achieving less in their careers, lower salaries. The risk of depression and anxiety goes up when folks have not been treated for their ADHD, those prolonged frustrations that go along with it and some of the underachievement that occurs often will lead to mood symptoms, anxiety, sleep issues. So it's not just the side effects of medication one needs to look at. They need to be weighing the pros and cons of choosing to, if one doesn't receive treatment. The outcomes, life outcomes, can be significantly different.